Denise Winters submitting an assignment for pharmacology, Professor Hunt's class. The scenario this week is EMS has brought in a woman who was found in a park, called in a 911 call by a jogger who witnessed the patient screaming obscenities at her and then fell, seriously scraping her arm and face. The patient is bleeding, disoriented, combative, and accusing EMS of stealing her purse. Her hands are shaking severely, and she is shouting at the doctors and nurses that she needs her bottle. She is dirty, and she smells of stale body odor and urine. Based on my first impressions of this patient's actions and appearance, I suspect she is suffering from episodes of substance-induced psychosis. They are common in emergency departments. Substances that cause episodes of psychosis include alcohol, amphetamines, cannabis, cocaine, hallucinogens, opiates, PCP, and sedatives. Alcohol is a readily available and cheap and widely abused drug. Alcohol is a central nervous depressant that can easily cross the blood-brain barrier, causing effects within 5 to 30 minutes. Effects are based on the amount consumed and include relaxation, memory impairment, sedation, loss of coordination, decreased inhibition, and reduced judgment. From the Merkel Manual, withdrawal from alcohol causes anxiety, insomnia, and seizures. Long-term alcoholics may experience delirium tremens, DT, or alcohol withdrawal delirium, AWD. So, symptoms include confusion, disorientation, agitation, hallucinations, anxiety, panic, tremors, and paranoia. DTs or AWD is a severe type of withdrawal from alcohol. It usually starts about 2 to 3 days after someone who's dependent on alcohol ends a long drinking binge. However, symptoms from withdrawal of alcohol, amphetamines, cocaine, or PCP can last for several weeks. Secondary Parkinsonian is a term that refers to the symptoms produced by certain drugs, poisons, and traumatic lesions to the basal ganglia. This could be another explanation for the patient's hands shaking. What short and long-term health risks would I suspect this patient will face from the Merkel Manual's Professional Edition in alcohol.org 2021? Short-term health risks include failure to fulfill parenting, school, or work obligations, lowered inhibitions leading to poor social judgment, hazardous behavior such as driving under the influence, recurrent legal problems related to hazardous behavior, loss of coordination, loss of critical judgment. Long-term risks include brain damage, memory loss, loss of attention span, alcoholic hepatitis, liver fibrosis, throat, mouth, larynx, breast, liver, colon, and esophageal cancer, high blood pressure, cardiomyopathy, stroke, irregular heartbeat. What kind of assessments will this patient or may need? From our classroom book, Focus on Pharmacology, since alcohol and drug withdrawal mimics the effects of many antidepressant, anti-anxiety agents, and sedatives, healthcare personnel should verify which drugs the patient has consumed before any treatment. The patient may not be a good historian at the moment, therefore a blood panel should be drawn to determine the best medication treatment plan. Dosage levels of medication may be too high for the liver to process and could cause more harm. Appropriate immediate treatment is a calm environment, and patients with acute alcohol withdrawal are treated with benzodiazepines. I think I said that right. Products such as Valium and Librium. They are central nervous system depressant and are usually treat anxiety, but also for muscle relaxation and the prevention of seizures. Alcohol and drug abuse include behavioral counseling, self-help groups such as AA. First is to assess the substance used, and comorbidities determine whether there is hazardous use, substance abuse, or substance dependency. If there is hazardous use, treatment includes brief counseling and ongoing assessment. If there is substance abuse, treatment includes brief counseling, negotiating a plan, close follow-up. If abuse continues, more intensive treatment is recommended. If there is substance dependence, treatment includes brief counseling, referral for treatment, coordination of pharmaceutical help, such as antabuse. Antabuse works by stopping the metabolism of alcohol, causing headaches and nausea and vomiting within 5 to 10 minutes after alcohol is consumed. Other agents used to treat patients with alcoholism include Promax calcium, it's Campro, and Revia, I think is how you say that. All right, research question. Mental illness management includes both pharmacological and other therapeutic methods for treatment. Summarize how this is managed and the support of insurance. Is it sufficient? What could make it better? Be specific and support your statements. So there are mental health and substance abuse coverage options through Marketplace Health Plans. That's from the Mental Health and Substance Abuse Health Coverage Options website. Behavioral health treatment such as psychotherapy and counseling, mental and behavioral health, inpatient services, substance use disorder, commonly known as substance abuse treatment. Benefits will depend on your state and the health plan you choose. So pre-existing mental health and behavioral health conditions are covered and spending limits aren't allowed. Marketplace plans can't deny you coverage or charge you more for just because you have any pre-existing conditions, including mental health and substance use disorder conditions. Coverage for treatment of all pre-existing conditions begin the day your coverage starts. Marketplace plans cannot put yearly or lifetime dollar limits on coverage of any essential health benefits, including mental health or substance use disorder services. Marketplace must provide certain parity protections between mental health and substance abuse benefits on the one hand and medical and surgical benefits on the other. This generally means limits applied to mental health and substance abuse services cannot be more restrictive than limits applied to medical and surgical services. The limits covered by parity, there's the word parity, protections include financial, like deductibles, co-pays, co-insurance, and out-of-pocket limits. Treatments like limits the numbers of days or visits covered. Care management, like being required to get authorization of treatment before getting it. However, the laws have been partially successful because with any insurance group, lawyer lingo allows for loopholes in the rules. Insurance companies can easily circumvent mental health parity mandates by imposing restrictive standards of medical necessity. In a recent suit against United Healthcare, a federal court sided with patients who alleged the insurer was deliberately shortchanging mental health claims. The judge said United Behavioral Health wrote its guidelines for treatment much more narrowly than common medical standards, covering only enough to stabilize the patient and ignoring the effective treatment of members with an underlying condition. United Healthcare is not alone in their actions. They are just the one who got caught. In fact, researchers at the Congressional Budget Office reported that private insurance companies are paying 13 to 14% less for mental health care than Medicare does. That was from the Congressional Budget Office website. Just like doctors use scientific evidence to determine the safest, most effective treatment, insurers do the same to cover treatment consistent with guidelines showing when and where it's effective for patients. Improved objective tools to measure the need for treatment show effective evidence that the patient needs it. It's a medical necessity during the examination. And hiring doctors, nurses, and pharmacists to review the claims is another technique that could help bridge the gap. Remember, insurance companies are never in the patient's corner. They will do anything to save a dollar.